All right. For those of you who I do not know, I'm Tiffany Coet, Assistant Executive Director at CAS. I'm very pleased today to be joined by Carolyn Calhoun, who is from Ed Advance, and Kari Sullivan from the State Department of Education. They're joining us today to talk about LEAP, which we receive questions every now and then at CAS about LEAP, the process for home visits, what that looks like, as well as best practices for attendance. And I know attendance is something that all schools or most schools are struggling with since the pandemic. And we're seeing that trajectory start to drop for our chronically absent. So there are some great things happening out there. So without further ado, I'm going to introduce Carolyn. I'm just going to say, though, if you have questions, put them in the chat. We're going to stop if there's points along the way to answer those questions, but otherwise we're going to save them until the end. All right, so go ahead. The floor is yours.
Thank you so much, Tiffany. Good morning, everyone. As Tiffany mentioned, my name is Caroline Calhoun. I am a professional learning specialist at Ed Advance, the RESC in the northwest corner. It's very chilly this morning in the Litchfield Hills. And my background is actually as a classroom teacher. I taught for 20 years, 5th and 6th grade humanities in both Region 12 and in Easton, part of Region 9. And I joined the Ed Advance team about 4 years ago, post-pandemic. My husband and I were relocating back to be near my family in the northwest corner of the state. And at that juncture, I was debating what to do. I have my 092. My husband is an administrator, also an educator. And I was like, am I staying in the classroom? Am I doing something else? And I landed at Ed Advance, which is a really wonderful place to be. And I do a lot of social studies work, DEI work, and a lot of attendance and engagement work. And it is my pleasure to work alongside Kari Sullivan Custer at CSDE, who is the grant manager for the Learner Engagement Attendance Program, or LEAP. And I co-coordinate the program alongside another colleague at CREC. And we really work across the state helping folks get kids back to school. So we're very happy to see the numbers moving in the right direction statewide, but we know that still a lot of schools are struggling with how to tackle chronic absenteeism. So today's session is really designed to share some nuts and bolts about basics when it comes to attendance and engagement, thinking about the LEAP program and all the ins and outs of how it operates, and then also doing a little bit of work today together, reflecting about shifting our mindsets as we think about the attendance and engagement world. And I'd love to offer some time and space for Kari to introduce herself. She is our guru at the state, and if you have not met her before, she is very responsive and has a wealth of knowledge about this topic. So I will pass it to you, Kari, to introduce yourself.
Morning, everyone. I'm happy to be here this morning on this webinar. I am Kari Sullivan Custer at the State Department of Education. I've been working on attendance and engagement for over 10 years now, and we were very fortunate to have the LEAP program, which we launched in the middle or the beginning of the pandemic to support our families and students. And LEAP has, shown to be effective, especially in the secondary schools, for improving attendance. So I'm happy to be here to help with any questions or to support you and Caroline and Tiffany. If you ever need any assistance with attendance, I'm happy to help. I love to get phone calls and emails. So I'll put my email in the chat and turn it back over to Caroline.
Thank you, Kari. All right, next slide, please. So this morning, what we are going to do, we'll start off by building some context for the important work surrounding attendance and engagement. And then we want to give you an overview of LEAP. So this is our research-based relational home visit program. And then dig in a bit to the work around shifting mindsets that can really be a very fruitful piece to the attendance and engagement puzzle. As we frame today's session, it's important to note that Connecticut has been focusing on attendance and engagement for more than a decade. So the state has put considerable resources behind those efforts and has really created statewide structures, systems, and policies that support this work. So this foundation is what sets the stage for LEAP's success within the context of the state systems. Next slide, please. So our objectives today, we're hoping that you learn about the broader complexities and intersectionality of attendance. And we also want you to come away with an overall understanding of the LEAP relational home visit model and how to implement it. Next slide, please. So just some level setting when we think about definitions and defining terms, making sure we're all speaking the same language. Tackling chronic absenteeism really requires this all hands on deck approach because it's a symptom of much larger social and systemic issues. So it's often a result of interrelated, complex, and multifaceted problems. So including things like lack of access to adequate childcare or healthcare, lack of access to housing, food, transportation, all of these pieces really play a role in chronic absenteeism. So we define chronic absence as missing 10% or more of the school year, and it is comprised of any absence. So no matter the reason, excused, unexcused, suspensions, it all contributes to a student's chronic absence. So essentially, we think of chronic absenteeism as any missed learning opportunity. We need to note that this is different from truancy, which are those unexcused absences only. It's also different from average daily attendance, which is how many students show up to school each day. It's worth noting that a school can have what appears to be a very strong average daily attendance rate, so say over 90%. But within those students who are absent, you can still have chronic absenteeism. So in some ways, that average daily attendance can sort of mask the issue of chronic absenteeism. Next slide, please. So this data is from the US Department of Education, and these numbers are really staggering. So pre-pandemic, we were at about 8 million students chronically absent. Post-pandemic, that skyrocketed to 16 million. So nationwide, these rates remain high, particularly for early elementary and high school. Those seem to be the two most problematic areas. But these numbers make it so urgent to employ the tried and true family engagement principles, high impact strategies such as relational home visits. So this number was peak in 2021. It has been coming down each year, but we still have a lot of work to do to get back to those pre-pandemic levels. Next slide, please. So we know that chronic absence is a complex problem, but one thing that is often overlooked is what we call the ripple effect. So thinking about how the entirety of your school is impacted by absence. So we know it's important. We know it has major impacts on a chronically absent student's future. But if we think about it from this other angle as a ripple effect, more people are affected than we typically consider. So we always talk about how if a student is not at school, then all our efforts in terms of school culture and a meaningful curriculum are all for naught. But do we think very much about who is affected by absence beyond that individual child and how absence affects their future? So if we consider who's actually affected by a child's absence, you have the student, of course, who misses class. Then it's hard for them to come back, hard to catch up. They might be confused. They don't know what's going on in class. They might feel overwhelmed. You also have other individual students. The teachers need to spend time reviewing the same material from the day before with the student who was out, and then the whole class can get behind as a result. You also have often students working in groups. You need that whole team to get the work done. So when team members are absent, the whole team can suffer. Teachers, I know when I was in the classroom, it was always really difficult when students came back after any period of time out, trying to catch them up, reteaching lessons, while also keeping my other students engaged with new material, taking extra time outside of class to help these students. It's not an easy balance. So if I'm constantly reteaching, how can I get to new material? When we think about the school as a whole, instruction can slow down when we have chronic absenteeism affecting a swath of the student population. Achievement drops. The need for remedial courses can increase, and students' academic achievement can take a big hit. This is costly to the school. Funding can be tied to attendance, so the resources for the school can take a hit too. So all schools are impacted in some way by chronic absence. And really, the overall takeaway from this is that it's a major impact on learning, achievement, time, and money. The organization Attendance Works out of California is a close partner with CSDE on all things attendance. Their executive director, Hetty Chang, is really a national expert when it comes to everything to do with attendance. They created a video related to the ripple effect of chronic absence, which I have linked in the speaker notes when you get the deck. So on the next slide, let's just think about this notion of the ripple effect. So how do you see this playing out in your school or in your district? We'd love for you to add to the chat or unmute and share your thinking. And I'll just give a moment for folks to think about that, and we will monitor the chat. So anyone, feel free. There we go. Thank you, Elizabeth. So teachers addressing the missed instruction, not being able to support students who need extra instruction is an issue at your school. And that is super common. Students who had learning gaps then get confused for learning disabilities. That is such a great point. More time on reviewing curriculum rather than introducing new material. So this tends to really be the case across buildings where the chronic absence rate tends to be higher. You start to have this ripple effect across the building, across the classroom, across multiple students. Thank you for those who just contributed to the chat. We appreciate it. This is just food for thought as you continue to tackle chronic absence in your building or in your district, depending on your role. We wanted to take a moment to look at Connecticut's education landscape. On the right, you can see the chronic absenteeism rates for the last decade, and highlighted in blue, you can see the pre-pandemic levels were at just over 10%. They spiked to over 23% in 2021-22, and we got them down to 17% this past school year, which is wonderful, but we still have work to do. Next slide, please. This is a slide that really highlights some of the data from CSDE's performance office. So the chronic absence rate last year declined by 2.3% for all students, and it declined 3% among students with high needs. So we think about our students with high needs as students who qualify for free and reduced lunch, students who are English language learners, and students who have an IEP. And the other piece, data-wise, is that all race and ethnic groups also declined last year, which was really good news. So last school year, over 11,500 more students attended school regularly as compared to the year prior. So when we look at that, the total number of students who were chronically absent last year was still over 87,000. So we're really thinking about each individual child and how we can get them back on track and in school. Next slide, please. So when Kari and I worked together to think about what is in place in Connecticut and why different states around the country turn to Connecticut as a leader in this work, I was recently at a conference in New Orleans. It was an international conference on the it was an organization called INSA, the International Network of School Attendance. It was formed after the pandemic, and it really was striking to learn that countries from all over the world are encountering the same problems with chronic absence and a lot of the same root causes or barriers as we are experiencing not only in Connecticut, but across the United States. What became really clear, I was presenting at that conference with a colleague from New Haven, Gemma Joseph Lumpkin, who is the chief of New Haven's Youth Community Family Engagement Office. And it became so clear to us that folks were really turning to Connecticut for answers, trying to figure out what is it that Connecticut is doing well that we can replicate not only in another state in the US, but in another country. We had folks at our session from Uruguay, Ireland, Spain, Australia, Japan, Holland, and it was really striking how the stories they shared, the anecdotes, the barriers were so completely relatable to what we're experiencing here in the US and in Connecticut. So these key ingredients about Connecticut systems and structures are what we're really sharing with other people doing this work as they try to make gains. So when we think about the key ingredients to a comprehensive, all hands on deck approach to attendance and engagement, you really need these pieces in place. You need to have a functioning district attendance team that is meeting with fidelity. You need to have, likewise, that school attendance team meeting with fidelity. Whatever data tracking you are implementing, utilizing, you need to think about data transparency. Who has access to that data? Is the analysis happening regularly? You need to be thinking about those equitable policies and procedures to keep everybody on the same page when it comes to attendance policy. You also need to be thinking through that multi-tiered system of supports. For so long, people in education have been using this same pyramid structure or multi-tiered system of supports for academics, also for behavior. The same thing is true to use this same model when it comes to attendance and engagement. So thinking about that tiered intervention model. Another piece that really makes Connecticut a leader in this work is the strategic partnerships that we forge with different organizations such as Attendance Works out of California. Thinking about how to leverage community partners as you do this work. The last ingredient is thinking about shared accountability. And not only that accountability piece, but that continuous improvement. Are we constantly looking to do better, to learn more, to be better in this work? An important resource for everybody on the call today is CSDE's Prevention and Intervention Guide, which is linked there. It really goes in depth and has a ton of information and resources. We encourage you to check that out. But in addition to these key ingredients that you see on the screen, what we've really come to understand is that alongside these systems and structures, we really need to have a shift in mindset when it comes to attendance and engagement. So we think of that as kind of the secret sauce to these 7 different key ingredients to make a comprehensive all hands on deck approach successful. Next slide, please. So when we think about that, a mindset shift, I'd love for you to just reflect on what you think a mindset is, and then what about a mindset shift? And again, if you can add to the chat, I don't know that you can unmute, but if you can add to the chat to help the conversation, that would be great. Thank you, Michael. A mindset revolves around how a person perceives and interprets a situation. Kristen, mindset is a belief in something. Thank you, Nicole. Mindset is your attitudes, your beliefs. Kelly, changing the way you think about something. Excellent. Thank you all for adding your thinking. Let's go to the next slide, please, Tiffany. Thank you, Kari. Seeing things from others' perspectives. Absolutely. So Frameworks Institute is a think tank that actually helps mission-driven organizations communicate about social issues in ways that build public will to support change. So this institute published a strategic report called Mindset Shifts. What are they? Why do they matter? And how do they happen? That is linked here for you if you're so inclined to take a deeper dive. But as you all mentioned, mindsets are these deep assumed patterns of thinking, and they shape how we make sense of the world and what we do. And when you think about how they happen, we really acquire our mindsets through participation in our social life. So it's a part of culture. We gain our mindsets through civil society, our families, schools, of course, all community institutions, and through the news and entertainment media, which is a really important point in this digital age. The reason they matter is because, as somebody put in the chat, they absolutely shape our behavior and our decisions. So how can we shift our own mindset or someone else's? We can think of mindsets like channels that sort of direct the flow of thinking. And that thinking has to be funneled in new directions many, many times in order for this to make any sort of shift in culture and in cognition. So mindset shifts, they depend on repetition, and it can take many, many years. This is not something that's an overnight switch. Next slide, please. So when we look at this slide, Kari and I and our colleagues who do this work day in and day out, we we were starting from a place of wanting folks to shift from what we call this old school truancy punitive mindset. So thinking about working on a family, thinking about attendance enforcement. This is where you have truancy officers banging on doors. And we wanted to really move away from that because all of the research suggests that that does not work. Instead, we wanted to move to a supportive chronic absenteeism model. So this is where we are not working on a family, we are working with a family. We are asking families, how can we help? And this mindset shift really is at the heart of family engagement. And the aim is to build a relationship with our families that is partnership focused as we try to tackle chronic absenteeism. Next slide, please. So much of the work that we do as educators is interrelated. So beyond all the statistics, beyond the data, more often than not, attendance and engagement are at the heart of all other school leadership, big picture thinking, and initiatives. So we can think of attendance and engagement as the umbrella under which so many of our intertwined priorities fall. I find this helpful because as an administrator or as a teacher, so often educators are overwhelmed with the number of things they are juggling, the overflowing plate, the lack of bandwidth or capacity. But when we think about attendance and engagement, not as a separate bucket or silo that is adding work to our plate, but instead it's at the heart of everything we do and is all connected to the work we're doing and all sorts of other initiatives within a building, then it really, in my mind, it eases that sense of stress around something else. And instead, it's central to the work we're doing. Next slide, please. So I love this graphic just illustrating this interrelationship. So as we think about attendance and engagement, I encourage you to view it as the intersection of everything we do. We can't really dig into attendance and engagement without thinking about the root causes of absenteeism and disengagement. So if kids feel like they're included and that they belong and that their school is a safe, welcoming space, and if their school communities are meeting kids and families where they are, and if leadership is making that explicit choice to lead through an equity lens, keeping inclusion and equity front and center by creating policies and a climate that are culturally responsive and cultivating a diverse, passionate educator workforce, then we are much more likely to have students and families who are engaged, who are present, who are successful. Next slide, please. So all of this context is part of the work that Connecticut has done as we sort of frame the landscape for when the Learner Engagement and Attendance Program, or LEAP, came to be. So let's dig in a little bit for you to learn more about the nuts and bolts of the program. Next slide, please. So Connecticut has a number of initiatives that we encourage you to take part in if you are not aware of these already. So LEAP is just one of these initiatives to help with attendance and engagement efforts. If you haven't been to Talk Tuesdays, we encourage you to register for these. These are bi-weekly informal gatherings where we have our partners at CIRC, and we usually have a district presenting about some sort of topic that is relevant to attendance and engagement. So it's informal, folks can jump on, it's 1 hour, and all of the previous Talk Tuesday sessions were recorded and they are archived on the CSDE website. I see Kari is linking things here. And the recordings are available, but also registration is always open for you to join. It's nothing formal. You don't have to commit to coming every time, but we encourage you to attend when you can. We get lots of positive feedback that folks feel like it's very helpful because they hear from other districts different challenges and problems of practice, and then can sort of brainstorm and hear about solutions together of what's working in other districts. Another initiative is Connecticut has our attendance awareness campaign, School is Better with You. And this included a really large scale survey of families we asked why they might not send a child to school. And we actually had over 5,000 respondents to this survey, which was a lot more than we were expecting. But this data was really helpful as we designed assets for the attendance awareness campaign. So for example, we heard recurring themes around confusion about when to send a kid with cold symptoms to school versus keeping them home. So this led us to educating parents with an asset, a flyer we created, when is sick too sick for school? And we also heard from lots of families that their children were missing school due to mental health. And this led us to create resources to help with anxiety. So all of these materials are available free of charge on CSDE's website. And we encourage you to check them out. You can download them and tailor them to your own district to use with your families. Another piece, sorry, if we can just go back for one more second. We wanted to mention the research collaborative CAS-CIAC, which is essentially a collaboration between higher institutions of education in Connecticut that collaborated to write an evaluation of the LEAP program. And it's unusual for universities and colleges to collaborate in this way. This was another use of pandemic relief dollars to gauge the effectiveness of all of the different programs that were funded through relief money post-pandemic. So CAS-CIAC's evaluation of LEAP proved that the program was effective. They've also written a second evaluation. All of these pieces really help Connecticut be at the forefront of this work. EdSite, if you're not familiar with EdSite, we encourage you to go on. This is the CSDE's dashboard with attendance data. There's also a secure version now that requires a password where you can dig into even more data surrounding specific students at your building or in your district. Lastly, Connecticut has a student attendance advisory team, which meets, I believe it's monthly. And so we have student voices at the table sharing their input about what's happening on the ground level and how the state can support students who might be chronically absent. And thank you, Kari. I see you're adding all of those pieces to the chat. Is there anything you wanted to add, Kari, about any of those initiatives?
No, I think the school is better review is something that's worth taking a look at because there's lots of resources in there that you can print out. There's a tools section or spread, I think it's called Spread the Word, where there's formatted documents that you can add your school logo, your district logo for communicating with families around the importance of attendance. There's tip sheets for what to say in morning announcements around attendance. So take a look at that. But I'll put in the link, the Connecticut Chronic Absence webpage, and all the links are there for all the resources. So you can go to that. Thank you.
All the links. Thank
All
you,
the
Kari.
links. Yes.
All right, next slide, please. So as we mentioned earlier, the multi-tiered system of supports, or MTSS, has been implemented in schools for many years when we think about SRBI, RTI, when we think about academic interventions, behavioral interventions, social emotional, all of these pieces. This model is equally effective when it comes to attendance and engagement. When we think about working smarter, when we think about working in a way that is not siloed and looking at the whole child, this model is something that can sort of tether us as we look at a whole child and what interventions they might need across any of those pieces as a student. So MTSS, this pyramid graphic that you're looking at is from Attendance Works. And when we think about those foundational whole school supports, and you look at this grid, our colleague Gemma Joseph Lumpkin in New Haven always talks about the more we can put into that foundation and into those tier 1 universal preventions, all of these whole school supports, then the fewer students we're going to have moving up through those interventions. We want to be living in the main levels of this house, so to speak. We do not want to be living in the attic, as she says, which is the tier 3 space. So trying to prevent students from moving into tier 2 and tier 3. So we think about these foundational supports as what we can do for the entire school, what we can do for all of our students and families, that is universal prevention for everybody. When we get to tier 2, this is where we are focusing on students who might have missed 10% to 19% of school days. So this is what we think of as early intervention. This is where LEAP lives. It is a tier 2 targeted intervention. It's not, as we move into tier 3, it's not an intensive intervention. It's not for those students who are missing 20% or more of school. That's where you get into really intense sort of case management. You are working with multiple agencies to try to manage some sort of situation for a student or a family. Really, the more you can do at the bottom of this pyramid, the fewer students ideally move into those higher tiers. I think that's everything we wanted to say for that. We could go to the next slide. Thank you, Tiffany. So LEAP is a research-based grant-funded opportunity to implement a relational multi-visit home visit program. It's designed as a targeted intervention for students who have missed or begun to miss too much school. So it's an example of a high-impact tier 2 intervention. So our original LEAP districts were selected for funding very strategically based on data that considered a variety of criteria, such as percentage of English language learners, percentage of students eligible for free and reduced price meals, and of course, chronic absence rates. We initially started with 14 districts. We are now up to 25 districts. We onboarded our second cohort of LEAP districts over the summer. So 25 districts currently receive LEAP funding. With that said, even if you are a district that does not receive LEAP funding, it is very plausible and manageable to adopt the LEAP philosophy or model, our cornerstones, and create your own version, even if you are not receiving funding from the grant. So all of that to say, we have trainings and all sorts of things that are available free of charge for everybody across the state, and we'll get more into that in a moment. Next slide, please. So why LEAP? As Kari mentioned, LEAP launched in April 2021. This was really in response to the high levels of chronic absence during the pandemic and because of remote learning. But in order to contextualize LEAP, we want to emphasize again that Connecticut has been addressing chronic absence through all of these different intentional policy levers for more than a decade. So without those long-standing efforts surrounding accountability, data integrity, dedicated staffing capacity, policy guidance, and really champions at the state level, LEAP would not have had the foundation upon which to build, which led to it being a successful program. Next slide, please. So the origins of LEAP during the pandemic, there was, as I'm sure you recall, this urgent need to address chronic absenteeism. We had a large number of students who were chronically absent across the state. We had whole families who had kind of dropped off and disappeared, who were disengaged from school. And we really wanted to better understand and address the barriers of attendance. We also knew that in order to be successful, we wanted to leverage the assets of all of the different community-based organizations that know these families and know these communities well. And we wanted this to have a common and sustained approach, something that wasn't just going to be, another task for teachers. We wanted to involve multiple staff members across buildings and communities to make this work. Next slide, please. One other piece to mention is that Connecticut started in September 2020 monthly data. So right away, we were the only state to do this, and this is what allowed us to really get a head start on tracking which students were chronically absent. So Connecticut has been sort of ahead of the curve with data dashboards for a long time, and we're starting to see other states have been doing similar things. So imitation is the highest form of flattery. That's what we tell ourselves as we see other states implementing similar methodologies. So who designed LEAP? This was really designed in partnership with all of Connecticut's regional education service centers. So ACES, CREC, EdAdvance, Learn, et cetera. But also with input from Attendance Works and from state and national experts to create something that had multiple voices at the table. It sort of baked in the parent-teacher home visit model, which is, it has some similarities and differences to LEAP, but it is essentially PTHV is a home visiting model, but it's more targeted as a tier 1 intervention, and it really relies on teachers doing the home visits. So LEAP is different in that way because it is targeted as a tier 2 intervention. And we really, we advocate that anybody who is willing to do a home visit and is willing to be trained, we are happy to have them conduct a home visit. The CAS-CIAC evaluation proved that it didn't matter if somebody was from the community, if they were from if they were an office clerk, an administrative assistant, a paraprofessional, an administrator, any of those roles were equally effective in conducting a home visit. Next slide, please. So how is LEAP funded? So the governor's office and CSDE worked closely to roll out LEAP, and we really included, it was COVID relief money to fund it from the start. So we had those 15 targeted school districts at the onset, and then we added 11 additional school districts. So originally we had $10.7 million in funding in the first year, $7 million the following year, and we are currently in this third phase of funding with another $7 million. So when we look at these figures, it gives it shows how much the governor's office and CSDE values this program, and we know that it's working, and those federal dollars are being put to good use. So on the next slide, if we think about how the LEAP model actually functions, so this was not designed to be implemented in isolation. So rather, its cornerstones dovetail with the broader components of comprehensive attendance and engagement and this multi-tiered system of support approach. So layering LEAP into a pre-existing broader attendance plan is part of what makes LEAP work. The cornerstones and operational components apply to both the state and local levels and are designed to cement operational and organizational commitment at a district level. So we think about trusting relationships. We want to be flexible and collaborative. We think about being culturally responsive to our students and families. LEAP is voluntary for all, so home visitors and families alike, it is voluntary. We are not forcing this on anyone. It is also very intentionally data-driven. And when we think about the operational components, this, as we said, is a tier 2 intervention for students missing 10 to 19% of school. And this is a multiple visit model focused on relationships. We're not right out of the gate going to a family's home and talking about attendance. We want to learn about the family and the student. What are your hopes and dreams for your child? Trying to think about things through a strengths-based lens. We want to develop that relationship so that eventually this trusting alliance is what's going to help bring the family and the student back into the fold of school. It is data informed. We have a professional development hub. The Connecticut Home Visit Hub is run out of CREC and offers these trainings across the state. We have home visitors from the school or the community, and we really have systems and structures designed to help implement LEAP on the ground. Next slide, please. So how do these LEAP relational home visits work? So they're voluntarily scheduled. This is something that is really important. It is not somebody showing up to a home unannounced. This is a planned, scheduled, agreed upon date and time with a family. So when a home visitor, or home visitors, I should say, because they always visit in pairs, when they meet with a family, and it might be at the family's home, it might be at a mutually agreed upon neutral location in the community, a park, a Dunkin' Donuts, a library. The goal at first is really to learn from the family. We want to understand a family, their context, their culture, what's happening within the family, and all of the different moving parts that might be affecting why a child isn't showing up to school. And this is an ongoing relationship. There's a clear purpose. You're trying to build that trusting relationship and alliance. Next slide, please. So the multiple home visit model is really important to note because, again, it's not one and done. We're not just showing up, banging on a door, trying to get a family to send their kid back to school and then leaving. This is instead very intentional. It's designed to foster that relationship. And the home visitors will initially contact the family. They schedule a home visit via phone or email. And then they might have to repeat that step multiple times in order to be able to schedule that home visit. It's planned, it's scheduled. Ideally, it's in person at the family's home or another location of the family's choosing. And then the research has really shown us through these CAS-CIAC evaluations that the in-person home visits are significantly more effective than a phone call. We encourage and really request that home visits should be done in pairs for a whole variety of reasons. And then there's follow-up after the visit. If you have a conversation where it becomes clear that a family might need access to a particular resource or information, the home visitor can follow up and provide that resource to the family. And then we continue the cycle. And for our purposes, to make sure that the program is functioning as it should, that we are aware of what's happening, we collect data. So home visitors complete what we call a home visitor log each time they contact or visit a family. And all of this helps to track the success of the program. So let's go to the next slide. So some systems and structures that we really direct or recommend to districts that they implement to support LEAP is that we have what we call a district or a school coordinator or both. And those people serve as the point people with CSDE and its partners as they implement the program. We support districts with all data collection and monitoring. My colleague, Dr. Elizabeth Rade at Advance, manages the data collection from all of our LEAP districts. And we also support folks with how to complete a home visit log. What does that look like? We really recommend leveraging those community partners and drawing upon their expertise to work with families and help get LEAP off the ground. We also really want districts to be looking to their families and students and asking them for input. We want their voices at the table as we think about what's working, what's not working. And this isn't just, something that we recommend for LEAP. This is really best practices when we think about how a district operates. Lastly, we help with thinking about districts and school level attendance teams functioning with fidelity, because those teams and the analysis of data around that table is what results in a family potentially being recommended for a LEAP home visit. Next slide, please. So we talked about the Connecticut Home Visit Hub and how all LEAP home visitors are trained through this hub at CREC. And home visitors receive compensation for their time and for their travel, and also for any training that they're doing. This is all, it depends on the district. It might be a stipend to do the work. It might be hourly. It really depends. Districts structure it differently, but it is something that is funded through the districts for their home visitors through the grant to help them complete this work. Next slide, please. So the Connecticut Home Visit Hub is this virtual training center. It's managed by my fellow LEAP co-coordinator, Francisco Baires at CREC, and it is staffed by a host of facilitators and coaches. So they offer the LEAP 101 training that all home visitors are required to attend before they begin conducting home visits. And these 101 trainings are 2 hours. They take place monthly and they're free and open to all. So we've linked here for you. The registration for our next upcoming session is on December 11th. If you're curious to learn more about LEAP, about what the home visitor role looks like, we encourage you to attend, even if, again, you're not a district that's receiving funding. Learning about all of this and thinking about ways you might be able to make it work in your district can be helpful. Additionally, our home visit hub is actually in the process of expanding. So we are going to be offering additional curriculum for administrators, for potentially teachers and districts, and we're still working out the kinks of that, but it might be open beyond just our LEAP districts. So keep your eye out for that. Thinking about all these different buckets of work related to attendance and engagement and what might be useful for practitioners. Next slide, please. So the hub has trained over 3,000 people who have attended LEAP 101. So this includes educators from all of our original and our new LEAP districts, but also 80 other non-LEAP districts across Connecticut. We've trained folks from over 30 states around the US and Canada. And as a result of that international conference that I was at in October, we are starting to get folks joining from around the world as well. Next slide, please. So if we want to dig into the actual numbers of students who have received a LEAP home visit, you can see that the program has grown exponentially year over year. So in its first year, we served over 8,600 students, almost 8,700 students, distinct students received a LEAP home visit. In 2022-23, that number increased dramatically to over 12,000 students received a visit. And this past school year, we had over 19,400 students receive a LEAP home visit. So you can see that the program, as it's expanded and sort of we've scaled up, we are really having an impact on a lot of students and families across Connecticut. Next slide, please. Part of what we do to ensure the success of the program and to help our districts who receive funding is we have this cycle of what we call continuous support. So we check in with each of our districts virtually in the fall. We have them submit sort of a quick reflection in January, noting challenges, successes. We check in again in person in February, really just wanting to have a real sense of how things are going on the ground, what's happening across your district, how can we help? And then at the end of the school year, we have our district submit an end of year reflection. All of this is designed so that we can continuously improve together and we can support the districts. So ongoing support includes those hub trainings with potentially expanded curriculum, data monitoring, and then we also hold monthly district coordinator meetings where folks can learn from one another and we can share CSDE updates. So is there proof that LEAP works? Fortunately, yes. We have this amazing evaluation from CAS-CIAC, which stands for the Center for Connecticut Education Research Collaboration. And in fact, the study they did was the largest, most robust study ever completed of a home visit program. And the research showed without a doubt that when implemented with fidelity, LEAP has a positive impact on our students and families. So you can imagine when that evaluation first came out, how excited we were to find that all of the hard work was paying off. And next slide, please. Some of the data was really illuminating. We found out that visits that were made in person had more of an impact than virtual visits or phone calls, which is something that we would probably think is the case, but having hard and fast data to prove it was really helpful. And when you look at the increase percentage-wise in attendance after receiving a home visit, this is where the data is really impressive. So 1 month after an initial home visit, we saw a 4% point increase in a student's attendance. 6 months after the initial home visit, there was a 10% point increase for pre-K through grade 5 students. And 6 months after that initial home visit, there was a 20-point increase for grades 6 through 12. So the impact for secondary students was really particularly noteworthy. And we also discovered from the evaluation that results didn't differ based on the title of the personnel conducting the home visit or whether the home visitor was from the school district or from a community-based organization. So that was really important information for us. Next slide, please. So in addition to improving attendance, which was of course the goal of the program, there were also additional unexpected benefits that were revealed through this qualitative and quantitative study. Families reported out there were improved family-school relationships, increased student attendance. Those first two are sort of what we would predict and what we would hope. But it also increased student engagement, achievement, feelings of belonging, and greater gratitude and appreciation. And often those sort of softer pieces are overlooked when it comes to data gathering. So we were really pleased with those results. So these benefits, when we think about especially those last couple of items on the list there, these are the benefits that home visitors and families were sharing with the evaluators. They shared anecdotes to prove these points. And these benefits are really the impacts from shifting our mindset to one that is partnership focused. So this is huge. It's all about those fundamental positive conditions for success, something that can sort of feel like a potentially narrow solution, a tier 2 approach to improving student attendance, can reap really powerful rewards system-wide. And it's not just in those big ways that we would expect, but in some of those harder to tackle pieces like belonging and appreciation. All right, next slide, please. So this is a video to highlight what LEAP looks like, and it is produced by CSDE's partner in this work, the Collaborative for Student Success, and you'll see lots of familiar faces from CSDE and across the state.
The last 2 or 3 years since COVID, we've had a lot of children who've been out of school. Kids are just missing a lot of learning.
No matter what kind of strategies that we put in the classroom, no matter the quality of our educators, if our students are not there in person, connected and engaged, then learning will not occur.
When this COVID relief money was coming into the picture, the state of Connecticut did a really terrific job of sort of being mindful about how best to use that money to serve our population of students.
The LEAP project really was our answer to chronic absenteeism.
I think LEAP was so successful because you had a trusted member of the community knocking on your door saying why we want your kid back in school. Her friends miss her. The teacher was asking about her. Any concerns you have, would you like to come and meet the teacher? Those personal contacts made a big difference in getting our kids back into the classroom.
LEAP stands for Learn, Engage, and Attendance. And that's the focus of the grant and the funding and the program, because we want students to learn and engage.
It starts with having conversations with families on how to get their children to school, but then it goes beyond that. I've been on home visits where families were struggling with finding food. They need resources for the baby. Their child is really struggling developmentally, having trouble with health issues.
As a home visitor, I really support the family. I go to their house and listen to them and care about them.
I have to push my daughter. I tell her all the time, you have to be better than me. I was working in the factory. I have cup of tuna in my both hands. I don't want it for my daughter. I wanted you to have a better job than me. Claudia heard my daughter go to school, and now she goes into college.
Home visiting for many years has had this connotation that it's punitive. LEAP has shown that there is a way to do home visiting that lifts up, applauds for what you're trying to do, but also reminding you that, okay, there might be something that you're falling down on, but how can we support you in getting your student back on track and in schools?
It's about that trusting relationship, because if that relationship is there, if the parent sees the value and the student sees the value and understands the value of what school is, then you see improved attendance. Then they want to come to schools.
The LEAP program led to approximately a 15 percentage point increase in attendance among those students who participate in the program. We're talking about an increase in attendance that is moving these students from chronically absent to an attendance rate that is more similar to other students.
The impact of just a single home visit on a child's attendance over time had an immediate impact of about 4% in 1 month, but 6 and 9 months later, that student's attendance was still improving.
The program actually was effective across a broad base of student attributes, including race and ethnicity, gender, free or reduced price lunch status, and even students with a disability.
With the infusion of a vast amount of money from the COVID relief dollars, it became necessary to have a mechanism to study how well these initiatives were working.
I think all of the evidence and the proof that we've collected shows, yes, absolutely, LEAP could and should be funded beyond these ARPA dollars, beyond the ESSER dollars. I think the data, though, is most powerful when coupled with those anecdotes. So the things you're hearing from on-the-ground home visitors, that's what makes it come alive.
Sometimes it's just one person to make the difference in the life of a child or a parent or a teenager.
Thank you, Tiffany. Kari, is there anything you want to say as we wrap that section about LEAP, or are there any questions? I haven't been monitoring the chat. Any questions about the LEAP model?
We had one question about, have there been any issues or info on the potential dangers involved in doing home visits?
Okay, thank you. I will say that, that is a piece to the puzzle of why we recommend that home visitors go out in pairs. We really rely on district level local control and best practices when it comes to how they set up their home visitors for success. I don't believe we have, Kari, any sort of statistics or anything about any situations that have emerged from this, but we really rely on folks in districts to use the best practices for their community and for their safety. Kari?
And I would add to that school districts and schools know their families, and they know, a lot of times what's going on with the families, and the visits do not have to be in the home. They can be in a community and a mutually agreed upon location. And for some people, they're more comfortable with that, and that's fine. And for some families, they're more comfortable with that, and that's fine. It does not have to be in the home, although it's in the name of the program, but to really use the same caution and safety and common sense that you would use in your day-to-day dealings in school to keep folks safe, but always two people.
Thank you, Kari. Anything else, Tiffany, that has cropped up in the chat or as we've been talking
nothing
about?
else.
Okay.
We're good to go.
Thank you. So let's dig into shifting mindsets. And if we go to the next slide, I've been working really closely with Gemma Joseph Lumpkin. As I mentioned, we were together in New Orleans presenting. Next slide, please. Thank you. And this, you can just see Gemma is in the hot pink in the front. And this is her department team. A lot of these folks are on the ground home visitors. They go out and work with families routinely, implementing LEAP, as well as a whole host of efforts across the New Haven School District. And really what we wanted to do, thinking about LEAP, thinking about New Haven as a LEAP district, we wanted to strengthen what was already working with Gemma's youth, community, family engagement staff. And we wanted to give them more training as we rolled out the LEAP model. Additionally, Gemma is actually in the midst of wrapping up her dissertation right now, and she really dug into work thinking about, after analyzing LEAP home visitor field notes and the reasons that home visitors were recording that a family might have a student who was chronically absent, really digging into all of those field notes. All of that led us to working more in depth on this mindset shift. So the next slide, as you saw earlier, is where we kind of started, just moving from this old school truancy punitive mindset to one that is supportive focused, working with a family. But our take on what a mindset shift looks like around this work kept expanding as we dug in, thinking about what does this actually mean in practice? What does this look like when we are working with our students and families? Next slide, please. So the more we worked together and the more I worked with Gemma's folks on the ground, we came back to this mindset shift as comprising multiple components. And so we landed on multiple elements of what this really entails, and we developed professional development around different aspects of the mindset shift for the folks engaging in this work on the ground level, doing home visits with families. So the more research we did, we also kept coming back to the understanding that it really takes a very long time to shift people's mindsets. So today we're going to give you just a little bit of a glimpse into some of the content that you can use for personal reflection on shifting our mindset, in particular to being culturally humble and culturally responsive. So this means that we have to dig into what culture is. We need to think about our own identity, and we need to examine bias. The other pieces on this graphic that you see in front of you, all pieces that we have worked together in New Haven on being equitable, being empathetic, being supportive, thinking through that strengths-based lens. These are all interrelated, of course, but there's lots of content you can use with folks around each of those different mindset shift pieces. Let's go to the next slide and just do a little bit of reflection together. So one piece that Gemma and I really came around to as we analyzed the field notes of her home visitors and as she continued with her research was that we need to think about real stories from families and students versus our own potential bias and deficit thinking. So while engaging with a student or family, we need to check for bias. Is our unconscious or implicit bias perhaps leading us to make assumptions? Are we thinking automatically through a deficit lens with a family? We need to be aware of our own emotional reactions, and we need to sort of check and evaluate ourselves as we do this work and as we work with our families. Next slide, please. So when we think about culture and bias, it really requires us to make sure we understand what we mean when we talk about culture. So how would you define culture? Go ahead and add to the chat what you would say. And I know Tiffany and I talked earlier that we both used to teach 5th and 6th grade humanities, and I know we always used to in 6th grade the kids could rattle off a definition of culture at the drop of a hat. So go ahead and add to the chat, please. How would you define culture? There we go. Michael, culture, a set of beliefs, behaviors, and customs tied to a person's heritage and identity. Love it. Jessica, the customs, beliefs, and values that come from family traditions and background. Excellent. All right. Kelly, thank you. Beliefs, feelings, and customs of a group. Great. You all can keep those rolling as we go to the next slide. So our list, when we think about culture, might look something like this. We heard from those in the chat: values, beliefs, customs, traditions. But also culture is collective. It's shared by a group. And everybody has a culture. It's learned, it influences and shapes our behavior. It's also transmitted from generation to generation. And importantly, it's often unconscious. So people are often unaware of how their behaviors and attitudes might have been shaped by their culture. So on the bottom, you can see there sort of a more comprehensive definition of culture, but I think we are all on the same page. Next slide, please. So some of you might be familiar with the concept of the iceberg concept of culture. So like an iceberg, when we think about culture, 9/10 of it is really below the surface. So we have surface culture, which is what we can see, versus deep culture, which are these unspoken or unconscious rules. So when it comes to those unspoken rules or unconscious rules within a culture, that's actually the bulk of what makes up a culture. So what are some examples of unspoken or unconscious rules that you can think of in your own culture? And it might be something in your school building. It might be something in your family. Anything goes here. Just as you brainstorm, something that is not necessarily explicit, but it's unspoken, it's unconscious when we think about culture. Go ahead and add your thinking to the chat. Michael, making eye contact with the person you are speaking with. Thank you. Absolutely. And interestingly, in some cultures, the unspoken, deeper culture message is you do make eye contact. And in some cultures, the unspoken rule is you don't make eye contact with an elder or a person you respect to show respect. It's a great example. Any other examples there? Thank you, Jessica. Personal space, touching while speaking. Another great example. These are so common, right? The different ways in which people are acculturated to personal space or touch can be very different. How people are dressed, absolutely. So those sort of unspoken rules about what you quote unquote are supposed to wear or not supposed to wear, depending on one's culture. Great examples. Deirdre, thank you. Responses to authority, absolutely. Great food for thought. And as you all continue to brainstorm, thinking about in your daily life, both in and out of school, how these unconscious and unspoken rules contribute to the culture of a building, of a classroom. There's lots of things that are explicit, right? We see classroom rules posted on the wall or school rules posted in the hallway. But what about those unconscious, unspoken rules that are equally contributing, or perhaps even more, to the culture of a classroom or a building? Let's go ahead to, I see another one on there. Thank you, Ethna. A huge one is their attitude toward their children. So cultural attitudes toward children, absolutely. Thank you all. At EdAdvance, we've been fortunate to work with Kathy Taylor. She is a consultant and an attorney. I think she's based in Waterbury. She's done a lot of work with Naugatuck Public Schools as well. And some of the content in this section is based on her work. So as she states, unconscious, instinctive, negative judgment about others, or what we call implicit bias, is inextricably tied to culture. So a person's multiple identities that give rise to cultural affiliations, and our cultural affiliations are often at the root of implicit bias. So when we think about how we interact with others, whether it's family members of our own, whether it is colleagues, whether it is administrators, whether it is our students and families, implicit bias can be at the root of how we interact with folks. Next slide, please. So Kathy Taylor shared this visual with us when she came to EdAdvance, and it was really powerful for everybody in the room, thinking about the fact that when we think about US culture, it is white supremacy culture, and thinking about the longer you swim in a culture, the more invisible it becomes. And that's a really powerful thought that is helpful to name and understand and reflect on. Kyle Guante Tran Meyer is a hip hop artist. He's a two-time National Poetry Slam champion. He's an activist, educator, and he's a writer based in Minneapolis. And he has this quote: "Remember, white supremacy is not a shark, it is the water." And I love that quote. It just illustrates how immersed, ingrained, entrenched we are in the white supremacist culture that is in the United States. Next slide, please. So again, credit to Kathy Taylor. When we think about our own individual growth or journey in becoming culturally proficient or competent or humble, it's really this set of attitudes, skills, and behaviors. So as we thought about the definition of culture, but when we think about cultural competence, it's these skills, behaviors, attitudes that enable individuals and organizations to establish effective interpersonal and working relationships that, and this is the important part, supersede cultural differences. So when we think about the organizational level of what policies and practices might be helping create those culturally responsive pieces, the behaviors at the individual level are what enables that cross-cultural interaction among a learning community. So when you think about the diversity within your school, within your district, within your community, this becomes incredibly important as you interact with others and how you are perhaps being aware or not of implicit bias and how it might be affecting those interpersonal interactions. Next slide, please. This graphic, again, thanks to Kathy Taylor, really shows that continuum. So we want to be moving away from those bottom steps on this staircase. We want to be moving away from what we call cultural destructiveness, incapacity, or blindness. We want to be moving into that pre-competence, cultural competence, proficiency, humility zone in those green colors on the top of the staircase. So I ask, this is not something we need to do in the chat or publicly. This is just food for thought and reflection. Think about where you might be on this continuum. And one thing that's worth noting is that depending on the circumstance, the situation, you might be on different parts of this continuum depending on the situation. So there might be some time when you feel like, oh, I'm feeling proficient in this particular piece and I'm able to articulate that or have a conversation and really demonstrate my proficiency. There might be another situation where you don't feel that comfort level or that confidence. So it's all a journey. Everybody is part of this, whether they're aware of it or not. And we just encourage you to think about it and reflect. The following slide has more details about each of these different steps on the continuum. So we encourage you to dig in, and really we're heading for that competence proficiency end of the spectrum, which is where we're seeing differences culturally, but we're esteeming it as an advocate for equity in the folks we are interacting with. Next slide, please. Thank you, Tiffany. So part of this work when we think about cultural responsiveness is really about our own identity. So it comes down to examining ourselves. We have to examine how we show up to the work of attendance and engagement as an educator. What are the beliefs we have based on our own personal cultures? What are the attitudes that we hold that we might be unintentionally allowing to influence our perspectives, and then biases that might form unknown blind spots in our thinking. So in other words, we really have to know our own stories and how those stories impact the work that we do with our students, with our families, and with our colleagues. And sometimes this reflection can be uncomfortable, but it really is helpful because in the end, it means we can be doing better. We know better, we do better, and we work better with our students and families. Next slide, please. So what's the point of all of this? Really, I want us to think about this idea that we each arrive at our work as an educator with students, with families, with colleagues, with our own lens, with our own lived experience, our own culture, and a shared experience in a white dominant culture. So in my case, my story, my lens is one of white privilege. I grew up in the northwest corner of Connecticut near Litchfield. I need to recognize that, name it, see my own cultural context clearly. I need to be on the alert for implicit bias and how it might affect my work. So I need to be a culturally humble educator as I work with colleagues, students, and families. I need to know I'll make mistakes. I'm not perfect. I can't fall into this trap of what we call white perfectionism. I need to be open-minded and not defensive and willing to hear and truly hear, not just listen. And I need to know that I'm on this continuum. It's an ongoing, lifelong process. It's an evolution. I need to keep evolving and learning as an individual. And similarly, as I lead this work, I need to know that individuals and organizations are at completely different places on this continuum. So one day you might be in a situation where you're at one point, another day you're at a different point. Your school, same thing, based on what's happening, might be at one point or another point at any given day, and everybody is at a different place. Next slide, please. So I would encourage you to reflect. think about as we contemplate this larger, broader take on attendance and engagement work, think about what's your story? What's your lens, your perspective, your own cultural context? And when you think about the demographics of your students and your families and your colleagues, and how that might be in contrast to your own cultural context and perspective, how might that affect your work? You don't have to add anything in the chat if you're willing to. We'd love to hear from you. But really, these are just points of reflection we encourage you to take away as you do this attendance and engagement work. So our final thoughts for you today are just that as we think about this broad bucket of work, attendance and engagement, we ask you to remember to think of it as that intersection of everything we do as educators to continue the work of shifting our mindset and to really keep relationships at the center of the work we do. And we would love to hear from you all. Questions, feel free to add anything to the chat. Feel free to also add any reflection points about that mindset shift work in the chat, and we are happy to hear from you. Kari and Tiffany, do you have any thoughts you want to add as you think about all of this?
No, I think there's such great work happening across the state. And this was so wonderful for people to really understand what LEAP is and how home visits can be one layer in all of the interventions that you're providing. So I thank you for partnering with us to get this out for, those building administrators who may not have had the information before or who weren't as familiar. I look forward to following. I know there's a page, is it on the state website? I've looked through it of all of the LEAP information, and I think there's a lot more resources here that I've never heard of. So I'm excited to go dive into some of those and find out more information. So I thank you both.
Absolutely. Kari, did you want to share anything?
Well, there was a question in the chat about difficult questions or scenarios and asking who things. I get calls all the time. So I'm here as a thought partner because as we talk about this mindset shift, and we know things are not black and white, that some family vacations may be something different than another family's vacation. One may be for a family obligation like a funeral, and another may be to go to Disney World. So we really want to think about how we're excusing, unexcusing absences based on individual students and family situations and not on our own perceptions of what that is. I want to thank Caroline. This is excellent. Caroline, a great job. And thank you all for coming. We know that chronic absences come down in October. We saw the data in many districts are seeing a continued decline and chronic absence and improvement in attendance. So keep up the good work. And we are here to help whatever you might need.
Absolutely. And I think, yes, contact information is in there. And I also put several resources in the deck at the end for everybody. Once the deck goes out, you can access all of that.
So thank you both so much. It was wonderful. We appreciate it.
Well, it was Caroline. She does an excellent job. Really does. And I love the mindset shift perspective on this issue, as well as discipline and other issues. I think it was fantastic. Thank you.